Hello ladies and gentlemen, welcome yet again to Andile M. Thank you so much for choosing to watch this video. Now on our previous video we spoke about type 1 diabetes mellitus, and like I said, in the next video, which is this one, we'll be elaborating more on type 2. Now with type 2 there isn't like an autoimmune process, but what happens is that there is insulin resistance. So your body is producing adequate insulin, but your cells are not responding to the insulin. Oh, before we carry on, a disclaimer yet again: none of our videos should be used for medical advice. If you are in need of medical attention, please do go to your local clinic or your doctor to seek medical advice. Neither should our videos be used as tutorial material for those that are still under training. So what happens again in type 2 is that you still have that hyperglycemic state, and the symptoms that you're gonna have is you're gonna feel that you need to drink a lot of water, you're going to go to the toilet a whole lot, and may feel that you are hungry all the time. So what happens, because your cells will not be able to use the glucose which you would have consumed, your body will now turn into lipolysis and proteolysis, which means that your body now breaks down your fat and your proteins to make energy, and that may lead to unexplained weight loss. Of course, there are risk factors like sedentary lifestyle, eating, unhealthy eating, that may all predispose you, and of course positive family history. So what I want to highlight really with type 2 is it's a non-communicable disease which is preventable, and for me, our health is our responsibility. And I also happen to be a primary healthcare freak. Like, I still believe that prevention is better than cure. So these are literally things that we can avoid. Until and unless you see somebody suffering from the complications of diabetes mellitus, which is what I want to highlight in this video, you will really start to take care of your health and make sure that you are walking on the right path as far as your health is concerned. So what happens is diabetes can affect your kidneys, it can affect your heart, it can affect your brain in the form of strokes. So what happens is your blood vessels, right, they're like a pipe like this, okay? So an amount of blood is supposed to flow through there, but when you have diseases such as diabetes mellitus, you end up having what we refer to as atheroma formation, which is like fat deposition in your blood vessels, and that will decrease the amount of blood that is supposed to go to certain organs. And when it comes to the heart, if that atheroma, the plug, if it grows large enough, it may give you heart attack, myocardial ischemias, and if you don't get intervention immediately, you may lose part of your heart muscle and it may lead to death. All right. Or for example, if it's not just a complete atheromatous plug, a thrombus may form there, because if you have injury on that vessel for any reason, you will have a clot forming, and it may dislodge and still give you myocardial ischemias. Also with stroke, you may get stroke, and the not so nice thing about stroke is the after effects of it, because you would have been suddenly fine and then now you cannot talk, you cannot walk. It depends on the extension of the stroke and the part of the brain which is affected, and most people who suffer stroke end up suffering from post-stroke depression. Not only them, but their families as well are affected, because life was like this and suddenly life has to be like that, and everybody has to adapt, and you don't know the role that you play in your family. You may be the breadwinner. It just becomes haphazard. Okay, so like I said, it can also affect your eyes. You really can turn blind from diabetes, especially if it is not controlled. And a problem with these diseases is that you may not know that you have them until you are at complication stage. For example, one of the complications of diabetes mellitus is diabetic foot sepsis, peripheral vascular disease. So what happens with diabetic foot sepsis is your nerves get affected, right? So your nerves help you to, or your central nervous system helps you to communicate with your environment. In fact, your nervous system in general, not just your central, it helps you to interact with your environment. For example, if you touch your hand now, you can feel that sensation. So once your nerves are damaged, you lose part of feeling sensation. So if you sustain a cut on your feet or something like that, you may not notice it, and then you end up getting infection, and the infection may grow such that it becomes systemic, and the only way becomes to amputate, and that is not nice. And most of the times when patients have to be amputated, we always also have to get psychologists involved, because you're going to be losing a part of your limb, and that may mean you might have to use crutches, you might lose your job, your whole life just changes. I really don't think that we should wait for disease to go to its tertiary stages and complications like that. Like I said, I'm a primary healthcare freak, and I still believe in prevention being better than cure. If you happen now to be already type 2 or living with a disease, for example diabetes mellitus, please then ensure that you take your medication, and you also do the lifestyle modification like exercising and eating healthy. There is what they term as DASH diet, which is the diet for those living with diabetes. And let me see what else I can tell you. Yes. So in terms of exercise, guys, this is not just a 5-minute jogging or skipping. An effective, scientifically proven exercise is exercise that lasts you cardio, like it means you are sweating, your heart rate goes up. Exercise that is for at least 30 minutes for at least 3 to 4 days of the week. That is the scientifically proven exercise. Healthy beneficiary with health benefits. It means you are not toning, the aim is to sweat. And maybe I can touch a little bit on gestational diabetes mellitus, because I don't want to make another video on that. So what happens, management and diagnosis is almost similar. What happens then is we need to look out for the potential complications that can happen, particularly during birth, because the baby might come out big. A big baby is a baby weighing more than 3.5 kgs, and a microsomic baby is a baby weighing 4 kg plus. So that may mean that if you are going to deliver normally, it might cause problems for you. You may complicate into cephalopelvic disproportion and a whole lot of other complications, and an emergency Caesar may need to be done. It's not nice, like I said, guys. And the baby may also be at risk of having hypoglycemic episodes. So there is a whole lot, and these are not just the only complications that there are. So in this video, that is basically what I wanted to highlight, that something as simple as taking care of your health, we may take it so light, but it may have adverse effects not only on us but on those that are around us. So I think I'll stop here for today. If there's any topic you'd like me to shed some light on, please do. If perhaps I said something in the video that you sort of don't have clarity on, please leave everything in the comment section, ask everything there. Thank you so much for watching the video up to this end. Until our next video, keep healthy, keep shining. Remember that your health is your responsibility. Angela signing out. I'll see you on the next video.